Hi, I'm Sergio, and today I'm here with Lea Mertens, one of the speakers for the Insight Conference 2021. Hello, Lea.
Hi, Sergio.
Now, before we start with the interview, I would like to hear from you a little bit of your academic background, if you would be so kind.
Yeah, of course. I've done my master's, actually a research master in Cognitive and Clinical Neuroscience in Maastricht at Maastricht University. And while doing that, I did my master's thesis at Imperial College London at the Center for Psychedelic Research. And afterwards, I joined Professor Dr. Gerhard Gründer for my PhD at the Central Institute of Mental Health. And I think a year ago, I've also started my clinical training, my clinical psychotherapy training.
Wow, so you're involved in a lot of things at the moment. I'm also pretty positive that you have a role in the episode study. Is that correct?
Yeah, exactly. I've actually initiated the trial with Professor Dr. Gerhard Gründer. We've planned it, and currently I'm pretty much the trial coordinator, and I'm also working as a therapist in the trial.
Wow, so it's been a long journey until approval of all the study processes and documents. Congratulations on that.
Yeah, thank you very much. It has been quite a long journey, but now we've managed. We've gotten funding for the trial. We've gotten all approvals. So yeah, that's really exciting, and I'm really looking forward to the next month and years.
And the trial, you're starting to see patients. Is that something you can say when that is happening?
Yeah, it's supposed to happen this summer. So we're quite positive that we will start seeing patients maybe next month.
That sounds very exciting. Now, back to the interview. We would like to ask you today 4 questions we have prepared. And the first being, how and why did you get into psychedelic research? And why are you staying?
Oh, wow, that's a really big question. um, I've always been fascinated by psychiatry and psychiatric disorders, and primarily the treatment of them. Or as I realized a few years into my studies and after my first clinical experiences, that there's actually a lack of efficacious treatments. And then throughout my studies, I actually gained more interest into the effects of psychoactive substances. So it was just like, how can biologically just simply changing our neurotransmission or molecular functioning have like such profound effects on our conscious experience? That was just at some point utterly fascinating to me. And immensely so with psychedelic substances, because yeah, they have this special phenomenology and subjective effects. And then when I learned that they actually have true clinical potential, I just knew that this is what I want to study, and that's the path I want to pursue. The second question, why I'm staying, well, it's a growing field. It's really exciting. It's actually a field I feel that there's still so much to learn, not just psychedelic research, but psychiatric research and neuroscience as well. So I think that's why I'm staying, because it's just really exciting, and you're learning new things every day.
Wonderful, wonderful. Well, yeah. Now to the second question, which I'm very curious about your opinion on this one. There are a lot of misconceptions in the field of psychedelic research and psychedelic science. What would you say is one of the common, or for you, the most relevant misconception in the field, or about your work specifically?
Maybe that we're all hippies. So, no. I guess it really differs depending on who we are talking about. So I think lay people, when I'm talking to them about my work, they're just really surprised, and they can't believe that we're actually giving or planning to give high doses of psilocybin to patients legally and actually let them trip, so to speak. And I believe this is because there still is this widespread misconception that psychedelic substances like LSD or psilocybin are inherently dangerous. With some colleagues, it's quite similar. So within the field of psychiatry and psychotherapy, there also is an overemphasis on potential risks of the therapy with psychedelic substances. And with some of them really being justified so to some extent. So for example, the risk of psychosis, it definitely has to be acknowledged. But with others, they're pretty much unjustified and currently have no research basis whatsoever, like the risk for addiction or a substance abuse disorder following psychedelic use.
So what I'm hearing here is that you're not all hippies. The risks are there, but the benefits shouldn't be ignored.
Yeah, I would say so. And the benefits definitely make these substances worth investigating.
Great. So you've been in the field for a couple of years now, right? How have you experienced in your position the development of the field, how it has become where we are right now, and what do you think it will look like in 5 years?
Well, I'm relatively young, so I've only been in the field for 4 years max, I would say. So it's a difficult question for me to answer. But maybe a very simple and quite obvious fact is that the field has really increased tremendously, I would say. And since it has increased, more high quality research and really controlled studies are being conducted, yielding high quality results and really more robust findings. And those promising and exciting findings are also catching the interest of more conservative researchers and clinicians. So what I see is, or what I sense is that there is a shift towards more acceptance in the traditional psychiatry, but also the general public.
What do you think the field will look like in 5 years?
Well, my guess would be that it's just going to develop similarly. So I'm foreseeing exactly this development. So even the field will grow even bigger. And if we really manage to prove the therapeutic potential of psychedelics, according to our very high standards of drug testing in clinical trials, then I'm pretty sure that psychedelic therapy will find its place in psychiatric treatment also in Germany.
Okay, very, very interesting. So in the course of the next couple of years, you think that if research shows promising results or shows the results that we are looking for, then there could be actually an implementation and in psychiatry or there could be a place in the mainstream for these kinds of therapies?
I think there still is quite some work to do. So we still lack these research results that actually show the data for the efficacy of psychedelic treatment in, for example, depression. And then we also have to implement a way how to integrate psychedelic therapy in our healthcare system. Right. But as you said, I do believe if we get the data and if we manage to prove the therapeutic potential, then I'm sure psychedelic therapy will find its place.
Great. Let's hope so. Let's do everything we can to bring the field to where it has to be. We are working now on small studies, as far as I know, and the first bigger one is maybe this one in Germany, among others, with 144 patients. So do you think this is going to have a greater impact in the field?
Mm-hmm. So what the studies or the studies they have been published so far, they are all quite small scale, and clinical trial testing, it goes in phases. So we have phase 1 trials with healthy participants, and we have phase 2, which are these small scale feasibility studies with patients, and then goes up to multi-center phase 3 trials, which are actually needed to get approval of a drug by the EMA, the European Medical Agency. So we do need these bigger trials, and only they will actually show the or will actually prove efficacy of certain drugs. So the hurdle is that those like big trials, multi-center trials, are really expensive, and they are really difficult to conduct by academic researchers.
And back to the Insights 2021. Are there any trends or presentations that have caught your attention until now? Is there anything that you would recommend or like to visit?
Well, yeah, actually, I'm a big fan of Katrin Preller and Franz Vollenweider, for example. The work they have been doing primarily with healthy subjects in the past decade, particularly on therapeutic neurobiological mechanisms, is just incredible. And now they're actually conducting clinical trials with depressed patients and with alcohol use disorder. So I'm very curious to hear about their preliminary results. But to be honest, the program in general looks really amazing. And I feel like the past year with the pandemic has really hindered us to network amongst research groups, which really is a shame. So I'm very excited for the Insight 2021 and that it's happening. And I'm pretty much looking forward to all of it.
Maybe one last question, just an extra, something that is of high interest of high interest for me is when talking about psychedelic therapy and handling this very potent substances. What do you think a therapist needs to have as a quality?
I think two things are really important. The first one is that the therapist, they need to know the substances, so they actually have to understand the effects and understand the time scale of the effects and understand like the potential range of occurrences that can happen. And the second one is quite related. They have to be open for anything to happen at the same time. Because I believe the biggest mistake is to make assumptions about the psychedelic experience that the patient or the person across from you is having. So a general openness and empathic understanding would be, for me, the key qualities of a therapist working with these substances.
That sounds beautiful. Lea, thank you very much for your time. Thank you for answering these questions, and I'm actually very looking forward to meeting live and in person in Berlin in September on the Insight.